What you need to know right now. Coronavirus cases surge in the South as known cases nationwide climb to more than 2.1 million. On the virus front lines, Georgia seeing jumps in hospitalizations, new cases, and daily deaths. We'll talk with the mayor of Augusta on stopping the spread. A favorite family destination trying to get back into the swim of things. The Long Island Aquarium reopens, but with warnings about the future for destinations like these, why they're asking for the public's help. Plus, helping you and your children navigate summer safely. Dr. Jen Ashton leads a roundtable of medical professionals taking your video questions. And it's Faith Friday here. Dr. Robert Turner from Vernon Chapel AME Church in Tulsa, the only building left standing after the worst race massacre in the nation's history. What he says about doing the hard work of change. And our nod to dads around the country, many on the front lines, fighting hard for our health, safety, and happiness.
Now, from ABC Studios in Times Square, Amy Robach with What You Need to Know.
Good afternoon, everyone. Thanks so much for joining us as we wrap up another week here on What You Need to Know. We're happy you're with us. The major developments we're tracking today: more than 8.5 million COVID-19 cases worldwide now, and more than 118,000 American lives lost, with close to 600,000 in this country recovering. With me now, ABC Chief Medical Correspondent Dr. Jen Ashton. And Dr. Jen, most of the country's attention focused on some of these rising COVID-19 cases in several states across this country. But another story attracting a lot of attention: this woman who claims she tested positive again for coronavirus, having 2 negative tests in between those positive tests. What could be going on with that story?
I'm glad we're talking about this, Amy, because it is getting a lot of attention, but this is a perfect example where you really need to dive deep. So here's what we know right now. A basic premise in infectious diseases is that once you've been exposed to one particular strain of a virus, it is not possible to be reinfected with that same strain. Now, the nasal swab test for SARS-CoV-2, you know, that's how we test people, depends on how you do it, where in the nose you do it, how, when in the course of the disease in terms of timing it's done. And like any test, there can be false positives and false negatives. But the bottom line is that detecting a virus on that nasal swab does not necessarily mean someone is actively infected. This comes out of data, you and I talked about this, released last month from the South Korean CDC. They looked at 285 cases just like this. Positive, then negative, then positive again. Not a single one of those people actually grew the virus in a lab. So that is really, really important data.
Yeah. So for those of us who don't have our medical degrees, can you explain to us how a virus can be present and not indicate infection?
Absolutely. And the key word here is viral debris. The theory is that when that test is done, that nasal swab, it's picking up fragments of the virus's genetic material, but the virus is not alive. So it's not the whole virus. And again, it depends. Are you just putting the Q-tip in the bottom of your nose? Are you putting it all the way back in the nasal pharynx? That can affect whether you get a positive or negative. And people can shed this virus and not still be actively infected, not be symptomatic, although some are, and they can be for a long time, and they are not contagious. So the theory is that you should not be using these nasal swabs to say, now you've recovered.
Wow, okay. And researchers, we should point out, are still looking into so much about testing. What do we still need to learn?
Well, we don't really still know when the ideal window or time in the course of someone's disease is to test them. We don't know, do you test someone every day? Do you test someone when they're the most symptomatic? A lot of that we're still figuring out. We don't know how long people